So to continue that idea of swallowing and how it works with the epiglottis and the pharynx and the esophagus, basically what you have is food is ingested. It is chewed mechanically by the teeth while salivary glands help break down a few of the chemically break down the enzymes or break down the food, and as the food is swallowed, the epiglottis closes over the larynx, allowing the food to actually pass through into the esophagus. The esophagus will then carry it into the stomach. So again, the major function of the epiglottis is actually to close over the trachea and to make sure that food that is swallowed doesn't go into the lungs. The function of the esophagus, however, that's that tube that the food passes through in order to get to the stomach. Its main function is to carry the bolus and fluids from the oral cavity to the stomach. There is no chemical digestion that takes place there, so there's no enzyme secreted to break anything down. That begins to happen in the mouth, and it continues to happen in the stomach, but does not take place in the esophagus. It does include a muscular tube, which is approximately 25 centimeters long, and it lies right behind the trachea. Again, the trachea goes towards the lungs. That's the tube that we breathe through. It passes from the pharynx through the thoracic cavity and the diaphragm into the abdominal cavity and to the stomach. The lower esophageal sphincter is also an important piece of the esophagus. It basically lays right at the junction of the esophagus and the stomach, so right where the two meet, and it is basically a opening and closing door. It contains a circular muscle that contracts to close off the stomach opening. And when food is swallowing, that opening, that sphincter will open back up, and the food is then released or enters into the stomach. So it's an essential part of the esophagus because it needs to be closed when food isn't being consumed. So it only needs to be open when the food's coming down. If it was open all the time, you'd have food still coming back up your esophagus. And if you've ever experienced heartburn, you are well aware of a sphincter that hasn't fully closed. So in that case, the heartburn is basically stomach contents, which are acidic, escaping into the esophagus. So it rises up into the esophagus, and you get that burning feeling. Peristalsis, the movement of food that actually travels down the esophagus. If you've ever tried to drink or eat upside down, you're aware that food will still actually enter the stomach, and this is because the movement down the esophagus is not due to gravity but peristalsis. So it's a rhythmic contraction of smooth muscles in the gastrointestinal tract that transport the bolus, and it works by basically a muscle being contracted, and it's almost like a wave that pushes the food all the way down. Just before the food, the muscle is relaxed, and right above the food, the muscle is being squeezed. So you have a relaxed muscle on one side and a contract muscle on the other side, so the food continues to move. This video kind of depicts actually peristalsis occurring. So if you watch, the esophagus will contract in a kind of circular motion, and that muscle contraction will actually carry all the way down and pushes any food or anything all the way down the esophagus. And as soon as you swallow, again, that muscle contraction is sitting right above the food and will force that food all the way down the esophagus until the relaxed muscle is right at the sphincter, and then that sphincter will open up and allow the food into the stomach. Now there's also layers of the gastrointestinal tract that you don't have to be aware of, and this occurs mostly throughout the gastrointestinal tract. Will be bringing this up specifically when we talked about the small intestine, but for now you should be aware of a few different layers, including the mucosa, which is the innermost layer, the submucosa just behind it, a system of muscles, the muscularis, which kind of sits behind that, and the serosa, which is just a thin layer on the very outer edge. The mucosa is just a mucous membrane layer. It lines the lumen. The lumen is just kind of that open area, the central cavity in the gastrointestinal tract. It contains glandular cells that secrete digestive enzymes. This will be essential in the small intestine to help break down and absorb the food. And contains goblet cells that secrete mucus, also essential because the food needs to pass smoothly through the intestine, as well as the esophagus. Just behind that is the submucosa. It's a loose connective tissue and contains blood vessels and lymph nodes. Now, because you are ingesting so many pathogens and bacteria and stuff in food, this layer is essential because it helps prevent from any kind of disease occurring in the stomach or throughout the digestive system. Behind that you have the muscularis, which again is just a smooth muscle layer, and it contains two layers. The muscle is what you see contracting when peristalsis occurs, and you have an inner circular layer, which was very evident in the video just seen, and then there's an outer longitudinal layer that together they both play a role in peristalsis. And then on the very outside you have the serosa, which is the outermost layer. It's a very thin layer and secretes fluid to keep the outer surface of the intestine moist.